Well, I'm not undecided on this. I am not declaring publicly for strategic reasons of being able to try to continue to influence this in the best direction possible. But I will tell you that the great untold story here is simply this. It wouldn't be hard at all for Republicans to come up with a consensus bill that would fully repeal Obamacare and replace it with a truly Republican version based on markets that would give us the best health care for the most people, for the least cost.
Well, apparently it would, because you guys haven't done it, right?
The challenge is we can't get it through the Byrd rule, and people like you should be telling that story. Because
the Byrd rule being what you can do or not do under reconciliation, right?
That's correct. And the alternative is to try to just get the thing to the floor for debate in the Senate, and it takes 60 votes to do that. And unless we can repeal the laws of mathematics or get 8 Democrats to come with us, which is harder than repealing the laws of mathematics, we have to change that rule and at least be able to get the bill to the floor. Now, you can have your cloture or something like that with 60 votes to get it off the floor, but unless we can get it to the floor, all Democrats have to do to completely cause Republicans to tear each other apart is do nothing, and that's too easy.
No, you're right about that. The machinery you have to go through just to proceed here, and that's what's causing this angst here, because
we've had plenty of Republican versions. We've come up with it. The very day Obamacare was passed, I was here. I lost my voice trying to stop it. That very day, we had a Republican motion to recommit that would have been an excellent alternative to Obamacare. The media didn't cover that. We've had several bills over the years of Republican versions, many of which I've signed on to. The media didn't cover that. The challenge that is before us is that everyone thinks the Republicans don't have an alternative or a plan. We do. We just can't fit it through
I understand
the Byrd rule. That's kind of like trying to shove a camel through a keyhole.
We have gotten into that. You're quite right. But as things stand now, working under the provisos you have to work on it right now. If you had to handicap this vote later on today, whether it's at 4 or 5, whatever, how do you think it's going to go?
Well, I'm going to answer your question, but I'm going to preface it by saying there are three kinds of people who try to do that. Those who don't know, those who don't know they don't know, and those who know they don't know. So I fall in the final category, but I would say that, that probably the momentum is toward passage.
Really? So are there concessions that are being made to the conservative caucus members that will tick off the moderate members, or what are you hearing?
I can say right now that those two factions are actually talking to each other.
Oh, all right.
And I think that that's a pretty important concern. Now, that may mean nothing. It often does. But I'm a hopeful guy.
All right. Are you hopeful that they can remove this 9 cents a percent surtax on the wealthy that so far has stayed in this?
Yeah, well, I'd like to see that go away, obviously. But the biggest challenge is being able to get rid of some of these Obamacare-era mandates that essentially ameliorate competition in markets. And markets are the only place where there's innovation. And when you have an equation like this where we have a completely infinite need to be met with a finite resource, we have to have innovation to make that equation come out right.
All right. Congressman, thank you very, very much.